OCD, or obsessive-compulsive disorder. It's a mental illness when patients have obsessions, bothersome, repetitive thoughts, ambivalences, and compulsions, ritual acts they feel they must do to reduce anxiety and uncertainty. Example: constantly washing hands for fear of germs or checking locks over and over. Best psychotherapies are cognitive behavioral therapy, CBT, especially the exposure and response prevention, ERP technique, is considered the most effective. Patients are exposed to the stimuli that trigger their obsessions and learn to avoid the compulsions. Also, mindfulness-based CBT, helps patients accept their thoughts without compulsively reacting. The quality of life these treatments offer significant improvement in reduction of obsessions and compulsions, leading to increased functioning and reduced anxiety. Schizophrenia. Schizophrenia is a serious mental disorder that affects thinking, feeling, and behavior. It is characterized by hallucinations, seeing or hearing things that are not there, beliefs that are not based in reality. One example is believing someone is stalking them or hearing voices that aren't there. Best psychotherapies are cognitive behavioral therapy, CBT. Focuses on identifying and modifying delusions, and family therapy, educating the family to better understand the disorder and reduce stress at home. Even social and vocational rehabilitation, improving social skills and supporting work rehabilitation. The quality of life. These offer reduction of symptoms, better social integration, and increased independence. However, medication is also usually required for stability. Bipolar disorder. Bipolar disorder is characterized by extreme mood swings, from mania, excessive euphoria or irritability, to depression, intense sadness, and hopelessness. Example: periods of hyperactivity and little sleep followed by severe depression and lack of energy. Best psychotherapies are cognitive behavioral therapy. Helps recognize warning signs of episodes and modify dysfunctional thoughts. Or interpersonal and social regulatory therapy focuses on regulating the daily schedule for mood stability. And psychoeducation, educating the patient and family to better manage symptoms. The quality of life these offer: improvement in relapse prevention and mood stability. It is usually combined with mood stabilizers. Depression. It is a persistent feeling of sadness and loss of interest in activities that normally bring joy. It is often accompanied by fatigue, self-reproach, and suicidal thoughts. One example is feeling of emptiness, lack of mood for social contact, and difficulty concentrating. Best psychotherapies are cognitive behavioral therapy. Focus on identifying and changing negative thoughts. It is particularly effective for moderate to severe depression. Other is interpersonal therapy. Focuses on social relationships and the role they play in depression, and mindfulness-based cognitive therapy, MBCT. Prevents relapse in people with recurrent depression. Quality of life offers improvement in mood, daily functioning, and social relationships. Psychosis. It is a condition in which the person loses touch with reality. It includes hallucinations, seeing or hearing things that aren't there, and delusions, false, irrational beliefs. An example is believing they have supernatural powers or hearing voices giving them orders. Best psychotherapies are cognitive behavioral therapy, which focuses on identifying hallucinations and delusions, reducing the anxiety they cause. Other is supportive psychotherapy, which provides emotional support and resilience building, or family therapy, and helps reduce family stress and support the patient. These give some quality of life off these treatments. Improvement in understanding symptoms and reduction in psychotic episodes. Medication is often necessary. Autism spectrum disorder, or ASD, is a neurodevelopmental disorder that affects social interaction, communication, and behavior. It is often accompanied by stereotyped movements and limited interests. One example is difficulty understanding social cues, repetitive movements such hand flapping, and intense interest in specific topics. Some effective psychotherapies are applied behavior analysis, aims to develop social and communication skills through positive reinforcement. Also, social skills therapy improves social interaction and understanding of social norms. Other is cognitive behavioral therapy, used to manage anxiety and obsessions. These offers quality of life, significant improvement in social inclusion, communication, and independence.